What
Real
if the person you trusted to save your life was the very one who would destroy it? In a Dallas operating room, patients lay sedated, placing their lives in the hands of a man in scrubs. But as the scalpel sliced through skin and muscle, a chilling reality began to surface: patients weren't getting better. They were waking up paralyzed, in excruciating pain, or not waking up at all. The man responsible wasn't a serial killer in the shadows. He was a respected neurosurgeon with a smile, a degree, and a license to operate. His name? Dr. Christopher Duntsch. And his nickname? Dr. Death. Born in Montana and raised in Tennessee, Christopher Duntsch seemed destined for greatness. He earned a Ph.D. and an M.D. from the University of Tennessee Health Science Center and entered the competitive world of neurosurgery with bold ambition. Duntsch had the credentials. He spoke with confidence. He told patients he was among the best spinal surgeons in the country. To hospitals, he was a financial asset. To patients, he was a lifeline. But behind the polished image was a man unraveling, emotionally, mentally, and professionally. Between 2011 and 2013, over 30 of Duntsch's patients were injured, some permanently. 2 people died under his care. All while hospitals quietly moved him along, without warning future patients. Duntsch wasn't just driven. He was obsessed with prestige, power, and being seen as a genius in his field. Colleagues described him as arrogant, erratic, and reckless. He boasted that he could do surgeries others wouldn't dare attempt. He drank heavily, abused drugs, and once operated after staying up all night. In one email to a friend, he wrote, "I am ready to leave the love and kindness and goodness and patience, and become a cold-blooded killer." The line between confidence and delusion was blurring. And soon, patients would pay the price. One of his first victims was Jerry Summers, his childhood best friend. Duntsch promised to help him with neck pain. But during surgery, he severed a major nerve, leaving Summers a quadriplegic. Still, hospitals didn't report him. And he kept operating. Then came Kelly Martin, a 55-year-old woman needing a routine procedure. During surgery, Duntsch tore an artery, and she bled out internally. She died hours later. He operated on Floella Brown, a 64-year-old teacher, and caused a stroke by cutting into her vertebral artery. She died days later. Despite growing concerns, Duntsch wasn't immediately stopped. Instead, hospitals simply let him go quietly, fearing lawsuits more than the lives of future patients. It took brave physicians, like Dr. Randall Kirby and Dr. Robert Henderson, to begin sounding the alarm, going as far as to contact the Texas Medical Board, the district attorney, and eventually, the media. A disturbing pattern emerged. Inadequate post-op care. Ignored surgical protocols. Operating under the influence. Lying about his experience. One surgeon who observed his work said Duntsch seemed more like a butcher than a doctor. During the criminal trial, prosecutors didn't just present medical evidence, they painted a picture of calculated harm. The final straw was the case of Mary Efford, a woman who awoke from surgery unable to move her legs. A post-op MRI revealed Duntsch had implanted screws into her muscles instead of bone, and left surgical hardware floating inside her. She became the centerpiece of his trial, and her injuries were the basis of the first criminal conviction for malpractice in U.S. history. In 2017, Dr. Christopher Duntsch was sentenced to life in prison, convicted of intentionally harming an elderly patient. How did a man so obviously dangerous keep getting access to patients? Why did hospitals allow him to quietly resign rather than expose the truth? The Dr. Death case highlights a terrifying gap in the American medical system, a space where red tape, profit motives, and silence can allow dangerous individuals to hide behind a lab coat. Duntsch was not just a rogue doctor. He was a systemic failure, the result of ego unchecked, oversight ignored, and lives gambled away. To this day, some believe Duntsch was simply incompetent. Others think he was something far darker, a man who intentionally maimed and killed under the cover of medicine. What do you think? Was he evil, or dangerously deluded? Let us know in the comments below. Subscribe to Real Case Vault for more chilling true crime stories every week. And remember, sometimes the most dangerous people wear a white coat.